CNA Post-Therapy Vital Sign Assessment. Welcome to the quiz. Question 1. While assisting a resident with a meal, you notice they are pocketing food in their left cheek. What is the most appropriate action? Option A. Gently remind them to chew and swallow, and offer a small sip of liquid to help them swallow. After the meal, check the affected cheek for any pocketed food and remove it gently with a finger or toothbrush to prevent aspiration or mouth infections. Option B. Ignore it, as some people naturally hold food in their cheeks while chewing. Option C. Give them a different texture of food that is easier to manage. Option D. Reach into their mouth with your fingers and remove the food immediately. The answer is A. Addressing pocketing safely and checking afterward prevents aspiration. Option A is correct because it addresses the pocketing safely and checks afterward. Option B is incorrect because ignoring can lead to aspiration. Option C is incorrect because changing texture may not be necessary without assessment. Option D is incorrect because reaching in can cause injury or aspiration. Question 2. The RACE acronym is used for fire safety. What does the C stand for? Option A. Confine the fire by closing all doors and windows to prevent it from spreading. Option B. Call the fire department after removing those in immediate danger. Option C. Carry everyone out of the building. Option D. Cool the fire with water from an extinguisher. The answer is A. RACE stands for rescue, alarm, confine, extinguish. Option A is correct. RACE stands for rescue, alarm, confine, extinguish. Option B is A, alarm. Option C is not part of RACE. Option D is not part of RACE. Question 3. You are taking a resident's blood pressure. The cuff you are using is too small for the resident's arm. How will this affect the reading? Option A. The reading will be falsely high. A cuff that is too small requires more pressure to occlude the artery, leading to an overestimation of the blood pressure. Option B. The reading will be falsely low. Option C. It will have no significant effect on the accuracy of the reading. Option D. It will be difficult to hear the correct cough sounds. The answer is A. A too small cuff gives a falsely high reading. Option A is correct because a too small cuff gives a falsely high reading. Option B is the opposite. Option C is incorrect. Option D may occur, but the primary effect is false high. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. A resident with a feeding tube is lying flat in bed. What is the primary risk associated with this position? Option A. The resident is at high risk for aspiration pneumonia if they vomit, regurgitate, or if the feeding backs up into the esophagus, as there is no gravity to help keep it down. Option B. The tube may become kinked or dislodged more easily. Option C. The resident may be uncomfortable and unable to sleep. Option D. The tube feeding could flow too quickly due to gravity, causing cramping or diarrhea. The answer is A. Lying flat increases aspiration risk. Option A is correct because lying flat increases aspiration risk. Option B is possible but not primary. Option C is comfort. Option D is possible but not primary. Question 5. A resident who is a Jehovah's Witness is scheduled for surgery and has a note in their chart refusing blood transfusions. The family asks you to convince them to accept blood if needed during surgery. What should you do? Option A. Respect the resident's advance directive and religious beliefs. Refuse to discuss it with them and report the family's request to the nurse, as the resident's wishes must be honored. Option B. Talk to the resident about the importance of blood transfusions in saving lives. Option C. Tell the family you will try to convince them for the sake of their loved one's safety. Option D. Agree with the family that the resident is being unreasonable and suggest they speak to the doctor. The answer is A. You must honor the resident's advance directive. Option A is correct because you must honor the resident's advance directive. Option B is incorrect because trying to convince violates their rights. Option C is incorrect because trying to convince violates their rights. Option D is incorrect because agreeing with family is inappropriate. Question 6. You are assisting a resident to get dressed. They want to wear a brightly colored, mismatched outfit that does not go together. What should you do? Option A. Let them choose what they want to wear, respecting their right to make choices about their personal appearance and self-expression, even if it doesn't match. Option B. Tell them the outfit doesn't match and pick out something more coordinated for them. Option C. Go ask a family member what they prefer the resident to wear. Option D. Dress them in the facility's standard clothing to avoid this issue. The answer is A. Respecting resident choice and autonomy is paramount. Option A is correct because respecting resident choice and autonomy is paramount, even if the outfit is mismatched. Option B is incorrect because imposing your preference disregards their autonomy. Option C is incorrect because family may not know their preference. Option D is incorrect because facility clothing limits choice. Great job! Don't forget to subscribe. Bye.